Oh, yeah.
Ooh. All right. Oh, gosh. Ooh. Am I the first person to crack your toes today or this week? Ever. So we have Rita back. She had such a really interesting video. Maybe go back and see it if you can. But she had scoliosis surgery at 12 years old. Yeah. Then we worked on you because you've had a lot of chronic tension, muscle imbalances and pain throughout your life. One of the things you'll see, and you'll see the picture of this now, is she couldn't lift her arm past this. And now she's got it much higher. Now you might be going, that's not great, but it's actually great. It's actually great, right?
It's a big improvement.
Compared to that she couldn't lift it at all.
Yeah.
Now she'll feel the tension and pain here, but it's not
good, but
it's not stuck.
Right.
And it used to be stuck.
Right.
And when it's stuck at a low level, it's hard to put your shirt on. It's hard to put a jacket on. It's hard to do a lot of things, right? Yeah. So what other things did you notice?
I noticed, so you leveled out my hips kind of because my body felt like it was on a slant while I was walking all the time. So now I feel more centered.
Okay.
I still get tight and it's still a challenge to walk far, but my legs are even and my hips are a little more even. So at least I don't feel like I'm walking like this constantly. Right. And I'm able to move because before I could only get my hand to here, but now I could get it to here.
Okay.
I'm doing the stretches you recommended on my shoulders, so that's helping. And need more neck stuff. My shoulders are always going to be tight. But
so it's a work in progress, and we're considering how many years you've had some, aches and pains and imbalances that you didn't know you'd have to deal with your whole life.
Right? Exactly.
So it's really cool that you're making some progress. And for her, progress is a big deal.
It is.
Yeah. So let's have you sit. We're going to jump in and do some more stuff. I'm not going to reverse her scoliosis, but we're working with what she's dealing with and helping her manage her, the ability to feel better. That's really what we're doing today. And we're getting there, right?
Yeah, we're working.
We're working towards it. Okay, so I'm on the back of the shoulder now. And here, turn a little bit. And so we're back in here. And this is a crazy muscle knot. Don't you think that stands out as a tight one?
I thought that was bone.
It's actually muscle, but it feels like bone. She's right. Ooh. So part of that arm coming back here is this area too. Do you feel that?
Yep.
So she was saying she can't wrap her arm behind her right there. That's a bad spot.
Yeah.
This feels like a rock, right? Doesn't it feel like a rock or a piece of steel?
Yeah.
And it's basically just her trap. And look at this.
Yeah, that hurts here. Though.
Yeah. But we're getting more range of motion. Do you see this, everybody? It hurts, but we're moving it. Now turn this way. Okay. So now I'm in the front of the deltoid, anterior deltoid, and this is nasty. Really tight muscle, and you feel the pain in it, right?
Yeah, that's where all the pain happens when I lift my arm.
Now I know you work at the computer sometimes, right? All the time. And since we started working, are you able to get a little bit more hours in before the body starts really hurting? Like a longer time of work?
I haven't paid attention
to
that. I'll try to pay attention for next time.
Well, let me know next time I see you. Sometimes people can feel pain within the first 20 minutes of a business day.
No.
And that's upsetting. Yeah. Right? They're like, oh no, I got 7 hours left and my body already hurts.
Oh, that's just about the job.
Do you think it's more of like the emotional connection to the job itself?
Yeah. Sometimes.
Probably, that's true. Yeah, that sounds true. All right, so we're working in through here. I'm still, may I put your arm here? Is that okay?
That's fine.
Because I want to keep it at this height. Yeah. And I'm rolling the muscle now. I'm coming in. I'm working a little cross fiber. So I'm coming across the fiber this way. And I have very strong fingers, don't you think, from
Yeah.
doing this for years? And so I'm not easy on her. I'm digging in. You have the great shirt. I love that shirt. Look at how cute that shirt is.
My brother-in-law made it.
Did he?
Yeah, he sells them. He sells different things, but yeah.
It's really fun.
He created it, yeah.
It's a fun piece. All right, right in there.
Yeah.
All right. Oh, gosh. All right, I want to come up here. And I'm
yeah.
really right in the top of the humerus by the bicipital tendon. And I'm going to adjust into this a few times. Good. And we're going to go into that knot that we had before. Remember that one?
Yeah.
Good. Now try to put that arm behind your back. So it's getting there.
Yeah.
You know, it's a process. Let's do this side.
Less of a pull.
Look, so this one's better, right? But this is what she's been dealing with for how long? Years.
Forever.
Yeah, decades.
Yeah.
Right?
Yeah.
If you had the surgery when you're 12 and you're 25 now.
Right. Next
So it's
week
been-
I'll be 24.
Yeah. So it's only 12 years. I'm going to do a little adjustment on your neck, okay? You wanted a little bit more this week, so
Yeah.
I'm going to do a little more.
Oh yeah.
Ooh.
I like that.
That was more than I thought.
That was good.
Drop this side. That one might not go. Okay, that one we can't do that way because of the restriction she has in her neck and, you know, the previous surgery we talked about. But I'm going to do a little bit more tapping. So you're going to tilt your head back and I'm going to come into C2 and C5 and C7 and one more time on C2. Tilt your head back. There you go. Now move your neck around, see how it feels. A little looser?
Yeah. Oh, and this clavicle's been cracking again.
All right, so let's do this.
Whenever I move it, just this little click.
So I'm going into the clavicle. Move again. How do you feel?
This is doing like some grinding thing here, but.
And here. All right, let's do this next. Let's get you on the table. When I met her, the leg was like this almost. But imagine, because the hip was out. But that's pretty close.
It feels so much better.
Yeah, it's normal. So I'm going to pull on this. There you go. On this side. Good, and pushing the leg down. Woo! She's laughing. But am I the first person to crack your toes today or this week? Ever. All right. You don't get that often. All right, so we're just loosening the ankles up. And that'll give her a better walking gait because the ankle should be some bit of a shock absorber when you land your foot on the ground. And her ankles are so tight. There we go. And then this will loosen up the ankle and give her more flexibility. Okay, good. You're just going to hold this for a second. Good. All right, you know, this is a process, and she's doing really well. She's doing her stretches. And the main thing is you're making progress. Progress is a big deal. All right. So the next thing I'm going to do is I'm going to have you get up and walk around, okay? So you ready?
Yep.
Thank you. And when you clear your head, you can walk. And I would walk, 20 feet up that way and then come back. How do you feel?
My lower back is feeling really
All right.
tight.
So we got to do that next, okay?
Face down?
Yeah. How do you feel face down? Is that okay?
That'll work.
We'll have someone get up, walk around, evaluate, and we can always get them back on the table. She didn't mention anything about all the good stuff I did on her feet. Did you notice if your feet were looser? No, she said right away, oh, my lower back. Okay, it's true. I deserve that. So I'm down here in the sacrum, and then I'm going to come up to here. Is that too much? You let me know if something's too much. So we only have 2 hours of this left, and then she'll be okay. Feels nice though, right? Just to loosen some of these muscles up. They get tight. I mean, if you're watching, you have to realize she literally has metal bars in her back that were surgically implanted when she was 12 years old. So imagine if you sat all day at the computer with steel bars. Not one, but 2 steel bars. And they are screwed into her bones. And then they put the skin and muscles back on top. And all these years later, it creates a lot of pain. They saved her life though. We talked about that in the first video, that they estimated she wouldn't live past 30 if she didn't get the surgery. And that's really not an exaggeration. I agree with that assessment. It's not like some scare of your medical doctor. It's true. Because with the advanced scoliosis, she could have had pressure on her heart and lungs, and that could have eventually overwhelmed her body and shortened her life tremendously. So she did the right thing.
The doctor had said that it was a 77% curvature total.
So she had 77% curvature total at the time of when they did the work on her. So that's extreme. And it's nice that you, had that handled. Okay, so I'm going to do this spot. And this is an adjusting instrument called the activator. And then I'm going to switch to something else. I'm giving you everything. Ortho adjuster. It's a percussive instrument and pushes the bones in. All right, let's get you walking again. Oh, good. Look at that. Are you just saying that? You're teasing me.
They did feel good. I'm teasing a little, but they did feel good.
She's teasing me. She just knows that I needed to hear about her ankle and her toes. But how do you feel?
My lower back is a little better.
Okay.
It's a little looser than it was. That feels good.
Which bird do you like better?
I mean, they're both crazy.
I like this one.
I like her because she's unhinged.
Yeah, that's the one I like
this
best.
One's just there.
Thanks, everybody.
Thank you.
All right, so to be continued.
To be continued.
Thanks. Leave Rita a nice message. She's an awesome person, and she's on a tough journey, and she could use some kindness and support. Thanks.